So chances are, if you didn't already know somebody who's been sick with COVID-19, you do now. The Omicron variant is spreading quickly everywhere, and it's not always easy to tell if you even have it. Our Chloe Thibault joins us live with a perspective that quite literally hits close to home. Good morning, Chloe.
Hey Lee, good morning. So yeah, if it wasn't obvious, I'm live from home this morning, and that's because last week I tested positive for COVID-19. Now I'm vaccinated and boosted, and the symptoms I had at first really weren't that obvious. So I spoke with some health experts about what we should all be doing right now, even if we're feeling just slightly under the weather, and whether it's even possible to tell the difference between COVID-19 and the cold in some cases. So Dr. Dora Mills with MaineHealth says in some cases there will be differences between symptoms. If you have COVID-19, you might experience fatigue or a loss of taste or smell. She says with the Omicron variant, though, those symptoms might not even be present, so just having a sore throat or a cough could mean you have COVID-19. Now, that being said, the only way to know for sure is to get tested. If you have any kind of symptoms, or if you know that you've been exposed to COVID-19, Dr. Mills says you should assume you have it and try to get a test as soon as possible. Dr. Gavin Ducker with Northern Light Health says the coronavirus is one of the group of viruses that causes the common cold, so that's another reason why it may be difficult to know for sure if you have COVID-19 specifically. He says above all else, testing is key for people.
They need to know that whether they have to isolate or even quarantine, depending on their vaccine status, and reduce the risks to family and loved ones. That's very easy for me to say. It's a challenge for many individuals to get tested promptly at the moment.
If you do test positive and you have symptoms, there's no reason to go and get another test. Our testing centers are really pretty overwhelmed right now. And, a positive test for COVID, you can really take that to the bank.
And coming up in the next half hour, I'll have more details from these doctors about where they think we're at in the Omicron surge here in Maine and what could be coming next. Live at home this morning, Chloe Thibault, CENTER Maine.